the patient finds themselves with a very simple device. The device consists of 2 units, each containing an insole that is perfectly shaped to your foot, so you can't make a mistake. The imprint is yours. You remain seated, take the 2 units out of the case, and there is a cable provided that connects the machine to either the right or left unit. The patient, without socks or shoes of course, places their right and left foot inside the 2 units. Once your feet are inside, there are 2 buttons, a blue one and a red one, which is for emergencies. The patient puts their feet in, presses the blue button once, and the blue button turns on the device. It performs a check on all 4 motors and resets them to the correct position for stimulation. Once the check is finished, you press the blue button again, and finally the patient receives the therapy. The therapy is very quick. After 96 seconds, the machine emits 3 sounds and automatically turns off. At this point, the patient removes their feet from the device, moves the device aside, and while still seated, puts on their socks and shoes, then waits a couple of minutes after the stimulation. After about 2 minutes, these instructions are very important, so please pay close attention. The patient will then stand up slowly, making sure to keep both feet completely flat and firmly on the ground at all times without lifting their heels or toes off the surface. Why is that? Because if I stand up at the moment I stimulate the brain asks, "But why did you stimulate me? What do you want from me?" So if the patient stands up and slightly moves their right foot and left foot to get comfortable, that's the first imprint the brain receives, and for 2 days the patient will walk very poorly. But if instead we stand up, these are the main and fundamental instructions, with your feet planted firmly on the ground, and once you're standing, you take 2 long consecutive steps. Okay, the brain records that information. Why longer steps? Because if you can manage to take very long steps, you can also do normal ones, okay? And the stimulation ends with those 2 very long steps. From that point on, by taking the first step just before starting to walk, the patient should experience a significant improvement over the next 2 days. So it's very simple, very quick.